Introduction. Nanotechnology, the manipulation of matter at the nanoscale, has revolutionized various fields, including medicine. This emerging field of medical nanotechnology holds immense potential in revolutionizing the diagnosis, treatment, and management of osteoarthritis, a prevalent degenerative joint disorder affecting millions worldwide. By leveraging the unique properties and behavior of materials at the nanoscale, researchers have developed novel approaches for targeted drug delivery, imaging techniques, tissue engineering, and regenerative medicine, among other applications. This comprehensive script aims to provide detailed insights into the various aspects of medical nanotechnology for osteoarthritis management, from nanomaterials and drug delivery to stem cell therapies and commercialization. Osteoarthritis, the most common form of arthritis, is characterized by the progressive loss of joint cartilage resulting in pain, stiffness, and functional impairment. Nanotechnology offers promising solutions for the management of osteoarthritis by enhancing precise drug delivery, improving diagnostic techniques, and enabling regenerative therapies. At the core of nanotechnology's potential lies its ability to manipulate materials at the nanoscale, where unique physicochemical properties emerge. This allows for the development of nanoscale systems capable of targeted delivery, sustained release, and controlled release of therapeutics, paving the way for personalized medicine approaches in osteoarthritis management. Nanomaterials, such as nanoparticles, nanofibers, and nanocomposites, have gained considerable attention in the field of osteoarthritis management. These materials exhibit outstanding properties, including high surface area to volume ratio, tunable mechanical characteristics, and tailored surface functionalities. Nanoparticles, for instance, have shown potential as carriers to transport drugs to specific joints, ensuring localized treatment. The incorporation of nanoparticles within hydrogels and scaffolds has facilitated tissue engineering approaches and cartilage regeneration. Moreover, multifunctional nanomaterials have been developed to simultaneously provide drug delivery, diagnostics, and imaging capabilities, enabling real-time monitoring of treatment response. Traditional approaches for drug delivery often suffer from limitations, such as low drug bioavailability, off-target effects, and systemic toxicity. Nanotechnology offers innovative solutions through targeted drug delivery systems. By encapsulating therapeutics within nanoparticles or nanocarriers, drugs can be directly delivered to joints affected by osteoarthritis, maximizing therapeutic efficacy while minimizing systemic side effects. Various surface modification techniques can ensure the specific targeting of diseased tissues or cells, enhancing drug accumulation at the site of action. Additionally, stimuli-responsive nanoparticles have been designed to release drugs in response to specific triggers, such as pH changes or enzymatic activity, further improving therapeutic outcomes. Accurate diagnosis and monitoring of osteoarthritis play a crucial role in effective disease management. Nanotechnology has significantly advanced imaging techniques, enabling enhanced visualization of joint structures, cartilage integrity, and disease progression. Superparamagnetic iron oxide nanoparticles, for example, can serve as contrast agents in magnetic resonance imaging, MRI, to highlight cartilage defects. Quantum dots, semiconductor nanocrystals with unique optical properties, have demonstrated potential for fluorescence imaging and tracking of specific cells involved in osteoarthritis pathology. The integration of nanomaterials with imaging modalities enhances sensitivity, resolution, and specificity, facilitating early disease detection and improving treatment planning. The development of nanosensors has revolutionized the field of diagnostics, enabling the detection of specific biomarkers associated with osteoarthritis. Nanosensors, often composed of nanomaterials with tailored properties, can selectively bind to biomarkers present in bodily fluids or joint tissues. By employing various detection mechanisms, such as colorimetric, electrochemical, or surface-enhanced Raman spectroscopy, SERS, nanosensors can provide rapid and sensitive detection of disease-related biomolecules. These nanosensors hold great promise for early osteoarthritis diagnosis, disease monitoring, and assessing treatment efficacy by facilitating point-of-care testing and real-time monitoring of biomarker levels. The field of tissue engineering and regenerative medicine has embraced nanotechnology as a powerful tool for developing advanced strategies to repair and regenerate damaged joint tissues. Nanomaterials, such as nanofibers and nanoscaffolds, can mimic the native extracellular matrix and provide structural support to promote cell adhesion, proliferation, and differentiation. The use of nanomaterial-based hydrogels, loaded with growth factors or stem cells, has exhibited promising outcomes in stimulating tissue regeneration. Scaffold surface modifications with bioactive molecules or nanotopographical cues can further enhance cellular responses and guide tissue regeneration with improved functional outcomes. Bioactive molecules, such as growth factors and anti-inflammatory agents, hold tremendous potential in promoting tissue regeneration and reducing inflammation associated with osteoarthritis. However, their rapid degradation and short half-lives limit their therapeutic efficacy. Nanotechnology provides a solution through nanoencapsulation, where bioactive molecules are enclosed within nanosized carriers, such as liposomes or polymeric nanoparticles. The encapsulation protects the bioactive molecules from degradation, extending their half-lives and facilitating controlled release. This approach ensures sustained and localized delivery, enhancing therapeutic efficacy and reducing the required dosage, thereby minimizing potential side effects. Joint replacement surgery is often the last resort for severe osteoarthritis cases. Nanotechnology has paved the way for the development of advanced nanocomposites with improved mechanical properties and enhanced biological compatibility for joint replacement materials. The incorporation of nanofillers, such as carbon nanotubes or graphene, into polymer matrices has significantly strengthened the resulting nanocomposites. These nanocomposites can mimic the structural properties of natural tissues, reducing wear, enhancing load-bearing capacities, and promoting long-term implant success. Moreover, nanoscale surface modifications of joint prostheses have shown potential in improving osseointegration, minimizing implant-related complications, and facilitating faster recovery. Stem cell-based therapies offer promising avenues for tissue regeneration and repair in osteoarthritis. Nanotechnology has been instrumental in enhancing stem cell functions, improving their survival, and directing their differentiation toward chondrogenic lineages. Nanomaterials, such as nanofibrous scaffolds or nanocomposite hydrogels, can provide physical cues that mimic the native microenvironment, promoting stem cell adhesion, proliferation, and differentiation. Additionally, nanoparticles have been used to deliver growth factors or genetic material to enhance stem cell activities and promote cartilage regeneration. These nanotechnology-driven approaches have the potential to revolutionize regenerative medicine strategies and provide long-lasting solutions for osteoarthritis management. The development of nanoscale drug formulations has overcome many challenges associated with conventional pharmaceutical approaches in osteoarthritis management. Nanoparticles, liposomes, and micelles offer improved drug stability, increased drug loading capacity, and enhanced cellular uptake. These nanocarriers can deliver a wide range of therapeutics, including small molecules, biologics, and nucleic acids, with improved bioavailability and targeted delivery. Surface modifications with ligands or antibodies enable specific interaction with diseased joints, further enhancing therapeutic outcomes. Moreover, nanotechnology-based drug formulations have shown potential in overcoming drug resistance mechanisms and reducing treatment-related adverse effects, leading to improved patient outcomes. Nanotoxicology, the study of the potential hazards associated with nanomaterials, is of utmost importance in the development and translation of medical nanotechnology for osteoarthritis management. Despite the numerous benefits, the unique properties at the nanoscale raise concerns regarding their potential toxicity. Extensive research has been conducted to assess the safety profiles of nanomaterials, understand their interactions with biological systems, and establish guidelines for their safe use. By comprehensively investigating the physicochemical properties, biodistribution, and long-term effects of nanomaterials, researchers can develop safe and effective nanomedicines for osteoarthritis, ensuring patient safety throughout the treatment journey. The commercialization of medical nanotechnology for osteoarthritis management presents its own set of challenges and opportunities. Successful translation from bench to bedside requires overcoming regulatory hurdles, addressing manufacturing scalability, and demonstrating clinical efficacy and safety. Collaboration between academia, industry, and healthcare systems is crucial to facilitate technology transfer and commercial adoption. However, with the rapid advancements in nanotechnology, the future holds immense promise. Innovations like 3D bioprinting of joint tissues, smart nanomaterials for on-demand drug release, and completely personalized treatment regimes offer exciting possibilities for transforming osteoarthritis management. Continued research, investment, and interdisciplinary collaborations will be pivotal in realizing the full potential of medical nanotechnology for osteoarthritis and improving the quality of life for millions worldwide. In conclusion, medical nanotechnology holds immense promise in revolutionizing the diagnosis, treatment, and management of osteoarthritis. The integration of nanomaterials, targeted drug delivery systems, imaging techniques, nanosensors, and regenerative medicine approaches has provided innovative solutions to overcome the limitations of traditional osteoarthritis management. Through the use of nanomaterials, researchers can precisely deliver therapeutics to affected joints, enhancing treatment efficacy while minimizing systemic side effects. Imaging techniques incorporating nanotechnology enable accurate diagnosis and monitoring, paving the way for early intervention. tissue engineering and regenerative medicine, aided by nanotechnology, hold the potential to restore damaged joint tissues and improve functional outcomes. However, ensuring the safety and efficacy of nanomaterials through comprehensive toxicology assessments is paramount. The successful commercialization and future prospects of medical nanotechnology for osteoarthritis management rely on collaborations, regulatory support, and continued research advancements. As the field progresses, personalized and targeted treatments may become the norm, offering long-lasting relief and improved quality of life for osteoarthritis patients.